Hello, everyone, and welcome to the seminar of our monthly series where we aim to highlight rigorous research in the scientific study of international migration. We're so glad you can join us today. My name is David Layton, and I'm a faculty co-director of IPL, and I'll be moderating this webinar today. But first, a few housekeeping logics. Before we begin, this session is being recorded. A recording of the presentation will be available on the Immigration Policy Lab website and YouTube channel. We encourage you to ask questions throughout the presentation by using the Q&A button located at the bottom of your screen. During the last 15 minutes, I will select a few questions for our presenter to answer. Due to our limited time together, we will not be able to answer all of your questions. At the end of the webinar, we will send a link to a Google form in the Zoom chat where you can provide feedback and suggest speakers for future seminars. This link can also be found on the Immigration Policy Lab website. Now, it's my pleasure to introduce our speaker today, Mary Waters, who is the John L. Loeb Professor of Sociology at Harvard University, where she has taught since 1986. A sociologist and demographer, her work is focused on the integration of immigrants and their children, the social determinants of health, immigration policy, disasters and their aftermath, and the measurement and meaning of racial and ethnic identity. Her current projects include the study of older Latin immigrants and the American welfare state, as well as work on climate change and migration. She is currently co-editing a report to be issued this year based on an NAS panel on global forced migration and U.S. resettlement. She is an elected member of the American Academy of Arts and Sciences, the American Philosophical Society, and the National Academy of Sciences. On a personal note, Mary has studied second-generation immigrants in my own Brooklyn neighborhood, and unlike so much academic work, she illuminated for this native what was directly in front of him with clarity and compassion. Her talk today is entitled The Integration of Older Latino Immigrants in Massachusetts and Florida, the Role of Social Services. Mary, welcome.
Okay, well, thank you very much, David, for that lovely introduction. You and I and Bernie Sanders are all from the same neighborhood in Brooklyn, if I remember correctly. Um, and it's true that I have spent my career studying immigrants and the children of immigrants and really studying young people. And this is a change for me. Studying older Latino immigrants, and I'm going to talk about sort of why I've made that shift. To begin with, this is joint work with Rocio Calvo, who is a professor of social work at Boston College, and Melissa Hernandez Yasso, who is a graduate student in sociology at Harvard, and we're writing a book together on this work. And I should warn you at the outside that it's work in progress. And so I really would appreciate any advice anybody has to give. You can email me after this or tell me during the presentation, but it's a very much work in progress, and we're really in the thick of trying to understand what we have collected. So let me just set the stage here. Although most international immigrants are of working age, 20 to age 64, older adults are a rapidly growing segment of international migrants around the world. In 2020, 1 in 8 international migrants was an older adult, and this number is expected to double by 2060. The global north hosts the largest share of older immigrants as well as older natives, with more than 20 million in Europe and North America. In the United States, the number of immigrant older adults more than doubled just between the year 2000 and 2022. In 2022, 1 in 6 older adults in the US was foreign born, and this is projected to reach 1 in 4 by 2050. So non-Hispanic whites reported the highest share of older adults. Those white immigrants who are aging in place, but non-Hispanic Asians, non-Hispanic Blacks, and Hispanics have a large percentage, up to 8 to 14% of their population are over age 65. So, a lot of the research on immigrant incorporation has really focused on children and young adults. But Latino immigrants tend to, they're our largest immigrant group. They tend to live longer than other groups, but reach later life with more functional limitations. They have often worked in very difficult jobs that are physically demanding, and they have fewer assets than other groups of older adults. And it's striking that we don't know very much about how they manage later life, and how this shapes their incorporation, their own sense of belonging, and then how that sense of belonging reverberates down to their children and grandchildren. So we began this with a lot of research questions, and I'd say the formative question that we started out with was that a lot of European research on the integration of immigrants talks about the role of the welfare state and how access to welfare affects immigrants and their life course and their adaptation to the host society. And there's much less of that in the United States, in part because we have a less visible, a less generous welfare state. And really, the one place or the one time in life when the US has a visible and active social supports for people is, and generous, comparatively generous, social supports is in old age. So that's what the kind of theoretical question that brought us to this, which is how does welfare affect incorporation? But then as we understood that there's not a lot known about older immigrants, we broadened from thinking about access to social services, how they learn about it, how they're treated when they access it, to thinking about things like legal status and how that affects both what benefits people are eligible for, but also their willingness to apply, how they cope when they're not given health care. Old people spend a lot of time getting health care, and how do you cope when you're locked out of the entire system? And we designed our study so that we could look at state policy contexts. And so we are comparing older adults in Florida, which is a much less generous state, and Massachusetts, which is a very generous state, especially in terms of health care. And we also, because this really is an exploratory qualitative study, we were very interested in how national origin differences might affect older Latinos. So we decided on a range of sending countries to include in the study. And there also is another puzzle that we're using these data to try to understand. And this is comes from a publication by my colleague Rociel Calvo and colleagues. They looked at the Health and Retirement Survey and data, which is our best data on older adults in the United States. And what they found was similar to, maybe many of you know about, the Latino health paradox, which is that even though Latinos are quite poor in the United States and living and working in difficult jobs, et cetera, they have better health outcomes in general than native born. Well, they also found a well-being paradox. So among people over age 60, Hispanic immigrants reported the highest life satisfaction in the Health and Retirement Survey, higher than native-born Hispanics and higher than non-Hispanic whites and Blacks and Asians. And this is true even though they had the least socioeconomic resources among those groups and higher rates of chronic conditions and functional limitations, but they were the most satisfied with their lives. So this was also a puzzle that we're hoping to try to understand with this qualitative data. So I'll return to this at towards the end of the talk. So there's a lot of variation and heterogeneity among older Latino immigrants. Some key dimensions are when they migrated. Did they migrate as young people and age in place, or have they come recently? The sending country and the ethnicity that they share creates very different opportunities, both in terms of legal benefits in the United States and how they're treated in terms of their migration status, but also how the kinds of societies they came from and how they relate to their sending country. So if you think of Cubans who often came, well, the first wave really came following the revolution a long time ago, about 70 years ago or more, and Venezuelans who are very recent arrivals. So there's a lot of variation across sending countries. Legal status, there's citizens, permanent residents, people in liminal statuses like temporary protected status and asylum seekers, as well as undocumented people. Then there's the policy environment. And as the federal government has become more and more punitive towards immigrants, state level laws and resources have varied a lot. So what state you live in really determines a lot about how you are treated in the US. And then there's also local context, the prevalence of other immigrants, the cost of living, language environments, and what kind of places you're living in. So there's a lot of variables here. And we, in this qualitative exploratory study, we can only really begin to look at some of these themes. So what did we do? We did 207 in-depth life history, semi-structured interviews with adults over age 60. We were pushing for over age 65, but we included some who are 60 to 65. And the participants were from 5 countries: Mexico, Cuba, the Dominican Republic, El Salvador, and Venezuela. And these countries are the most numerous in Massachusetts and Florida, but also represent a range of what Portes calls contexts of reception. Portes and Rumbaugh call contexts of reception that really determine kind of how people are treated in the U.S. And we also include Puerto Ricans who are, of course, citizens of the United States. And these interviews were conducted in Massachusetts and Florida. We also did an additional round of interviews with key service providers, healthcare workers and social workers predominantly, and people in the nonprofit world. The data collection was between December 2019 and June 2022. So as you can see, the pandemic happened in the middle of the data collection. We had a lot before the pandemic hit. We did some on Zoom, and then we went back out into the field. Zoom really couldn't work with a lot of the people that we were trying to find. They were poor, they didn't have access to computers, and we didn't want to do it on a phone. So we did most of the data collection in person. We recruited people via community partners, community leaders in resource centers for older adults, churches, basically any way we could find people, but we were very cognizant that we should expand the sites and the networks and not have clusters of people, and not sample on the dependent variable, not sample on people who were getting help. So we were very clear not to do that. The interviews were conducted in Spanish by a team of Latino bilingual graduate students, and the coding and analysis is ongoing by a team of wonderful doctoral students using NVivo and MaxQDA. So we were able to find immigrants from most of these sending countries in both places, except for Salvadorans in Florida. We really struck out finding them. And so we really only have the Salvadorans from Massachusetts. They're an interesting group. For the other groups, we were able to find representatives in both states, and we have a range of legal statuses and a range of arrivals. But as you can see, the Venezuelans are very recent arrivals who came in the last after age 55. But there's a range among all of the other groups. So if you look at the gerontology literature and the literature on successful aging, there are some key areas that determine well-being in older adulthood. One is having sufficient income, wealth, stable housing to be able to live comfortably. Second is health, which is a big concern for older adults. Third is having social support, family, community, and social ties. This is very important as people age. And then finally, meaning and purpose, kind of looking back on your life and assessing it and thinking about what you've accomplished and what you're still accomplishing is important for successful aging. So I want to start, and that's really how we're organizing our findings and looking at the range of outcomes among the people that we've talked to. I want to begin just by highlighting some early findings that we have from our data, that some of which explode some preconceptions people might have about older adult immigrants. First, most respondents are still working, especially among non-citizens. Work is necessary for economic reasons, but it's also really important for people in how they construct deservingness for any aid they receive. It is also, and this was a surprise to me, reading the transcripts, but it's also a source of gratitude. Over and over again, people said to us, this country gave me the opportunity to work. And they're not working in, well, some are, but most are not working in jobs that you would feel grateful to have. But the opportunity to work at all is really why people came. And to give a better life for their children. And so they're very grateful and very proud of the fact that they have worked hard their whole lives. We often think of the Latino family as a large extended family that is respectful and helpful to older adults. And certainly that's true for many families. But resources flow in both directions, and even older, poor, very poor immigrants are both still supporting their even older relatives back in the sending country, but also they're supporting their younger generations. And during the pandemic, often when people were laid off from service jobs and construction jobs, the older adult in the family was sometimes the only person getting any income, because they were getting Social Security or SSI, and they were supporting many generations through that difficult time period. Another important thing coming out of our research is that the pan-ethnic category Latino and the importance of Spanish language can also mask differences, sources of tension, and life is not so simple as to think about. There's a literature on, say, the importance of concordant providers, of having, say, a doctor who speaks Spanish and who is also Latino. And what we find that's interesting in thinking about, in talking to people about providers, both healthcare providers, but also people in bureaucratic positions, social workers, people at the Social Security office. Um, Speaking Spanish is important, but as long as you have a translator, people really picked up much more on care and whether a doctor touched them, whether a doctor made eye contact, whether a bureaucrat was respectful. And sometimes the people that they felt most disrespected by were other Latinos, but who did not necessarily share their own background. So, say Mexicans in Florida report Puerto Ricans and Cubans, healthcare providers or bureaucrats looking down on them because they don't have a lot of education or because they uh, didn't behave in the way that the bureaucrats thought they should. And then legal status is also a very complicated intersection with life course trajectories. So legal status can really affect how old age unfolds. And I'll talk about sort of the trajectories that we see for legal status. So this is just a taste of how important work is for people who you would think might be out of the workforce by their age. Here's a 70-year-old man who's just been laid off from his job as a janitor. He says, "Here I am looking for a job if they will give it to me. When I fill out applications, they say they will call me. They never do. They think I'm too old. Many people have told me that I don't get a job because I look too old. They think because I'm 70, I cannot do anything, but I'm fine. If they give me the chance, they will see that I can still work. I need to work. I came to this country because things were very difficult in El Salvador, but things are very difficult here too. I'm very concerned about rent. Rent has to be on time, always. I live with my disabled wife. His wife had a stroke and is completely paralyzed. She cannot move. Thanks to God, she can hear. She understands everything, but she cannot talk. I need to feed her with a spoon, only soft foods. I need to take care of her. She doesn't get any help because she doesn't have a social security number. And then my mother, she is 90, lives in El Salvador. I need to send her money. I need to make money to survive. And here is another Venezuelan woman, age 68. I leave home at 5:30 a.m. to get the bus. I get to work at 7 to stay with the children. The house is a mess. The parents toss their clothes everywhere. I have to clean, cook, and take care of the laundry, including the ironing. I asked the lady of the house if I could get an increase because I couldn't make it with what they were giving me. Besides, I was supposed to take care of the children, not do all the housework. She said that she was going to give me only $20 more per week because I was having breakfast and lunch at the house. I told her that I was hungry and that's why I eat during the day. I cried for over 4 hours. I was so humiliated. I was a mechanical engineer in Venezuela. I love my country. I came here because I couldn't stay there any longer. I was very vocal against the government. That made my life very difficult at the end. So work is incredibly important, not only because of the necessities, but as you'll see in a bit, for also how people construct deservingness for what they get in the United States. So let me just talk a little bit about legal status and life trajectories. So the first typology, the first type of undocumented person is maybe what you might imagine, a person who arrived earlier in adulthood as a worker, aged in the United States without transitioning to LPR status. So these are people who have been here for a very long time and are undocumented. As they grow older, the hopes for adjustment diminish, although you will see in these transcripts there are still the hope that there will be an amnesty program. They often feel caught between returning home and remaining with their children and grandchildren in the United States. They cannot travel home. Their parents, siblings, sometimes children die without them back in the sending country. And there's a variation. Some come to see themselves as legitimate members of American society. Others struggle to accept the permanence of their undocumented status and that they won't return home. There's a second category, which are people who were undocumented and then have managed to legalize, either through marriage or through uh, uh, the adjustment of their status because of victim status, other kinds of ways in which people, it's hard to do, but some people have legalized. But their past undocumented status continues to shape their outcomes. Most people who are undocumented do not have formal employment. They avoid the system, and that means that their access to benefits and financial security are affected throughout their lifetime. So most of them don't have the work record that they need to get Social Security because they were working off the books. The positive aspect is that since they've aged in place, they do have community and social ties. But they're more likely to experience poverty and precarious aging despite being legalized. So papers don't mean everything, especially in terms of uh, uh, social benefits. Type 3 are late life undocumented arrivals, and they might be the very worst off. They arrive without papers at older ages. They face double isolation because of their legal status and also from age-related dependence. They don't have a community and they don't have any work history because they weren't here until they were older. Their adult children often can be protective, but they keep them at home. They're very isolated. And this applies to almost all of our Venezuelan respondents who are late arrival undocumented people. A fourth category are people with legal status who arrive in old age. They are basically retiring to the United States. They're often joining adult children who want help raising their own children. But they come in, even though they come in with a green card, they face a 5-year waiting period for federal benefits. This is partly offset in Massachusetts. They have a lack of U.S. work histories, which means no or minimal Social Security benefits. And for some, they imagine the U.S. as an attractive retirement destination, kind of thinking similarly to Americans who think about retiring to Mexico or Panama, but they have fewer protections once they get to the U.S. And finally, there are the dual citizens with transnational coverage. They're eligible for both U.S. and sending country social protection systems. Travel is possible. They're able to go back and forth. Some can think they'll return to the sending country eventually. They may still face racialization and stigma around social inequality, but they have more formal options for pensions and health care. So let me just say that in Florida versus Massachusetts, the safety net for both legal people who have green cards and citizens and undocumented immigration is very different. Florida is much less welcoming, but Florida does have some benefits, which is that they're much more bilingual in Florida. It's much easier to find Spanish-speaking help. And the Cuban presence makes a big difference, also a large Puerto Rican presence. And Cuban and Puerto Rican workers are throughout the infrastructure dealing with older people. Massachusetts is much more bureaucratic and comprehensive in coverage, but also people are more segregated. It's harder to find Spanish speakers, and it's more bureaucratic. So I'll go through this quickly, but federal benefits, people who are over age 65, who are citizens and LPRs, can get Medicare, Social Security. If they're poor, they can get, and they're not getting Social Security, they can get supplemental security income. They can get food stamps and help with paying for Medicare. Um, LPRs who have arrived recently, though, are not eligible for any of these federal benefits because of a 5-year waiting period. So even documented people are not eligible for all of, and undocumented people are not eligible for any federal benefits. So what Massachusetts does is it makes up for some of that. So Massachusetts has full mass health coverage, prescriptions, dental, vision, long-term care. It has state-funded food stamps from day one, so there's no 5-year waiting period for SNAP benefits. It has cash support in place of SSI for very poor legal permanent residents. After 5 years, it also increases the amount that you get from SSI. They have language access mandated for all the benefits that you get in Massachusetts, and people are eligible, regardless of their immigration status, for state subsidized elderly housing. Now, does not going to make anybody rich or even above the poverty line. The emergency income that is given to people who are legal permanent residents is $326 a month for the first 5 years. Plus, they can get $291 in Massachusetts SNAP, so that's $617 a month. And then after the 5 years, they also can get SSI. And the in Florida, it's much more restrictive. The only thing people can get really is emergency care. They can't get food stamps and they don't get any cash support. Health coverage in Massachusetts has been expanded. There's a health safety net for primary and specialty care. There's an extensive community health center network, and generally a protective climate for undocumented people. There's a health safety network that's provided. So if you go to the emergency room in Massachusetts and you're undocumented, everyone gets emergency care in the US. But in Massachusetts, what will happen is the doctor will flag that you don't have documentation status, and they will follow up with that electronic health record, and they will get you into the emergency mass health and the health service network, and they will cover primary care, specialist visits. It's available to all uninsured Massachusetts residents, and this is a very big benefit for people. Undocumented in Massachusetts, they get emergency Medicaid only, and a recent law in 2023 requires hospitals to ask about immigration status, which it has had a chilling effect. So, what difference do these state level experiences cause? We looked at access to services, how people get services, how they're treated when they get services. So we looked at individual agency. These are how people get services. Sometimes people seek information for themselves. They call agencies. They go to offices. They're very self-sufficient. Sometimes they get connected to services through bureaucratic incorporation. The medical or state providers or social workers will seek them out, inform them of their rights. Massachusetts does this very aggressively. Providers are the main entry point, the health providers, but then the services are bundled together. Mediated assistance is really what characterizes Florida to a great extent. Nonprofits and religious organizations connect them to charity, inform them of multiple opportunities, assist with translation, access to information. Many people would tell us their church gives them $100 a month in Florida so that they can cope with not having enough to eat, transportation because of physical disabilities. Um, Ethnic reliance is very important in both states, but more important in Florida, where finding out even what is available is very difficult for people. And undocumented people avoid asking for information. Some of them fear it will affect their status adjustment, others because they don't want to be a burden to the country. Literally, in these transcripts, you get older adults who are still working at difficult jobs, and they're undocumented. And you tell them in Massachusetts they can get certain benefits, and they say, "I don't want to be a burden on the United States." Um, this is really not what you would learn from our national government at this point. And others won't apply for anything because they perceive other people as more needy. Um, so here's some examples. Cubans are the poster children for individual agency. It's the government's obligation to give you Medicare, Social Security. That's what you pay your taxes for. You own it. The only thing you have to know is where the laws are, where you need to call, and where to ask. Many of these people are pretty unaware of how difficult this would be for people who don't speak English. Um, but often they talk about uh, uh, you get sick, you go to the hospital, even if you don't have insurance, they save you. My doctor, she calls me Mammy. She's Cuban, born here, a very good person. The Mexicans, as I said, mentioned being discriminated by other Latinos. The front desk worker is Hispanic, but that person has a very bad attitude. You can't ask her anything. She's very rude. I told her I feel really sick, and she says I can't see anyone because I don't have an appointment. Um, the system avoidance is very pronounced among undocumented people, but even among LPRs who are worried about sponsoring their children and grandchildren. Friends told me that I can ask for help because of my age, but I'm worried that it will affect me for my children. There is a woman I know that social services went to her house and put her down as disabled. She's getting money every month. She asked for her children, meaning to sponsor her children to immigrate before me, but she has not heard anything. I think the government, believe that she is going to use the money to help her children when they get here. This is why she has not heard anything. I told myself, be careful. Asking for help can affect my children. Here, a Mexican immigrant, reports that they got the check during the pandemic, but they asked the government not to, they are thinking of asking the government not to send us more money because we don't know how we're going to return it. And here, a farm worker in Florida says she doesn't go to the hospital because they put your information in a little sheet of paper. What if ICE gets it and comes for me? Um, so, uh, how they interact with and how they perceive getting benefits also affects the narratives they tell themselves about being deserving. So are you a hardworking good worker or a good wife? That is why you should get benefits. Or you're an American, you're like everyone else. Or my community deserves it. Or I am poor or disabled, a victim. That's why I deserve it. Or they feel like they're not deserving and do not belong. So how do they interpret this? The Cubans often are differentiating themselves from other immigrants who are not as good as they are. I learned American culture. It hasn't been easy to navigate the jungle of services, but because I worked with Americans, many others watch Spanish language television all day long. I watched it in English because I wanted to learn English. That's why I tell you my point of view is different from many other Latinos. So to return to that dilemma I started with at the beginning about a dual frame of reference, life satisfaction. Why are older Latino immigrants expressing higher life satisfaction than other native-born Latinos and other older people. The narratives of deservingness are related to this life satisfaction paradox. Partly people feel a sense of life satisfaction because they've kept the immigrant bargain. They worked hard and they're seeing that their children are having a better life because of the sacrifice of their migration and their lifelong work. Um, they also have a gratitude for the opportunity to work in the US, even for undocumented people. But just as when I studied younger immigrants coming to the United States in their working ages, and people would tell me that they loved their jobs, even though they were very difficult and low-paying jobs, because they were comparing them to what they could earn in the sending country. Many of the older people are comparing the benefits that they get and the support that they get in the United States to what they would have gotten in the sending country. So this sense of inclusion based on aid, even if it's very meager, gives them the sense of satisfaction and the sense that they made the right decision to migrate earlier. So here's a Mexican man who says, the doctors treat you well. If you don't have money, they still treat you. And yes, in Mexico, it's different. There, if you have money, they treat you. If you don't, they don't. If you have money, they take care of you. But here in the US, they did. And this is a Salvadoran 76-year-old. For those of us who think positively, everything becomes more positive, easier. If you're going to be protesting all the time, those of us who don't do anything for the country are demanding a lot of things, and that's not right. It depends more on a person's attitude. From what I've seen, what I think from the people I've talked to, here we have everything a person could need. If you look for it, ask questions, and inform yourself. Here's a homeless 67-year-old male living in homeless shelters and on the street, and uh, and obviously with a very bad drinking problem. And listen to the gratitude and the happiness he expresses about how he's treated. They take care of me at the hospital. Thank God here at the hospital, they don't let you die. Yes, they take in those who are lying in the street, those who are abandoned, everyone. I don't know how they do it, but thank God here the hospitals take care of you. There have been times when they've taken me in unconscious from alcohol, and when I come to, they're bringing me back in the hospital. They treat me, and then they discharge me. Then I keep drinking, and then so on and so on. What can I say? Those people, the doctors, thank God, because they help everyone. They help all the people from the street, not just me. They help all of them, whether they are Hispanic, whether they are all kinds of colors. They help them here because if they didn't help them, maybe we'd all be dead. Because I'm not the only one on the street. There are millions of people on the street, millions and millions of people. So then when we talk to him about getting this help and, whether he deserves it, and he responds, yes, I deserve it, because there are people who don't work, but sometimes when he needs money, he goes and he looks for work for a couple of hours at the Home Depot as a laborer. And he says, if there isn't any work, well, I'm used to eating there at the shelter. This is an 83-year-old Salvadoran man. He says, when the doctors were there, they were rubbing my skin because I had no hair on my head, rubbing my arm, the doctors and the other nurses the same way, affectionate. They would say to me, do you give me permission to bring you this medicine? Do you want to take it? Everything like that. And he talks about all of the help he has gotten from his medical insurance, even though he's not a citizen. He has somebody who comes to clean his apartment because of his medical condition. He says, this homeland gives me all of this, all of these things that I value like that. And then he thought about it. He thought, well, maybe I've earned it because I've never done anything wrong. My kids haven't done anything wrong. And he got a lot of people into AA. This is a different drinker than the other one. He got a lot of people into AA back in his sending country. So I'm going to conclude. There are many remaining questions that we are going to explore as we analyze these data further. how do people without any benefits cope? What are the changing federal policy environments doing to people over time? And how do the difficulties of getting benefits across Florida and Massachusetts play out for people? I want to end just by highlighting one study that one of the colleagues on this project, Melissa Hernandez Yasso, has been conducting on Mexican immigrants in the U.S. and the pension system in Mexico. So Mexico, and really it speaks to this question of transnational social protection that Peggy Levitt and colleagues have written about. So undocumented people in the U.S. Can't go back to Mexico. But there is a universal cash support system that was created by the two presidents in Mexico, AMLO, and then his successor, Scheinbaum, in 2019. And the current benefits are about $340 a month, with additional payments for people with disabilities and vulnerable people. But you need to prove that you're resident in Mexico to get it. But a recent constitutional reform makes all citizens entitled to receive it. AMLO declared that migrants should be covered. Scheinbaum has mentioned that they are evaluating ways to include them. So $340 doesn't seem like much, but with our interviews with undocumented Mexicans, it could be really life-changing in terms of what it would allow them to do. It would really increase their well-being. Mexican consulates in the U.S. already have several initiatives to cover services for the Mexican population. It's absolutely feasible, but they're not able to access it because they can't travel back to Mexico. So, and if you think about the fact that these immigrants have been sending remittances to Mexico for their whole working lives, uh, really one of the saddest things is that these people have been contributing to both societies all their lives. They're growing old in the United States, and they're locked out of both social protection systems. And so this is an opportunity, perhaps, that could support some of the Mexican immigrants aging in place if Mexico figured out how to help them. So I want to stop there and hear from all of you.
Let's see if I can get audio on. Can we hear me? Can you hear me?
Yes.
Excellent. Thank you so much for these illuminating stories organized in a way to address a crucial uh, public policy issue. We have a set of questions in 15 minutes. Please send some questions if you wish. We will have some time. We'll start with Andrei Horenko, who asks about how you are able to distinguish lack of information about eligibility from system avoidance driven by fear or mistrust. Uh, so, are you able to extract this from your interviews and be able to distinguish these two different, you could say, reasons for low participation?
Yeah, it's a good question. Some, the interviewers know kind of what people are eligible for, and let them tell us what they get, and then towards the end of the interview, ask some questions about whether they have tried for various things. So we can tell, that people will say, "Oh, I didn't know I was eligible for that." What's more prevalent in the interviews is people saying, I know they'll treat me at the hospital, but I'm afraid to go. Or I know I could get the food stamps, but I'm worried about the public charge rule. Um, uh, the first Trump administration did a very good job of scaring people about getting any benefits, and what that would do to their ability. These are even legal people to sponsor relatives or to become citizens themselves. And then there also is the history of the 86 amnesty. So and your colleague David Assad has written about this, that undocumented people are really caught between wanting to establish their history as taxpayers and as good people and good citizens in case there is an amnesty, and wanting to avoid systems. And we see some of that in our interviews, but more kind of the people who are afraid or don't feel deserving enough to apply for the benefits that they think they are eligible for.
My colleague Assad is also your student, and
Yes.
we thank you so much for
I
training
still miss
him for his really compelling work. Uh, given your own intellectual background, I was a little bit surprised that there isn't much mention of networks,
Mhm.
and that how networks can help explain something which I'm trying to explain, you're trying to explain, and many others, is the so-called immigration paradox in health and life satisfaction. And it seems to me that in terms of health, there are a large number of well-trained nurses and doctors who are not allowed to work in that sector
Mhm.
in the bureaucratic world, who work on the gray economy,
Mhm.
uh, giving medical support, and able to get medicines sort of through the gray economy. And the comparison of the gray economy to the American bureaucratic economy may help explain some of the success that is heretofore unexplained, because we're not looking at gray economies and the social networks that support them. Am I making sense? And
Yes, you're making a lot of sense, and it's just something I didn't get to in this talk. But we have asked people do go to natural healers. They go to if they can, they travel back to sending countries to get medical care if they can't get it in the United States, and they also uh, are in the informal social networks. So we do have data on that, and we are going to analyze it. I didn't have the ability to talk about, but you're right, David. This is and this is part of the answer of what do people do who have absolutely no formal medical care in the U.S., are undocumented and just kept out of all of the possible care that they need.
any other questions coming from our 57 participants here? Any last words, Mary?
No, if people have ideas of things that they would like us to look at, or especially if they have sort of larger data sources where we could begin to, I mean, this is very much uh, you know, a a story, a study which is really trying to sort of get the lay of the land, and then we really want to use other data sources to begin to look at sort of larger themes and larger correlations and causality between all of these variables that are affecting these older people.
So for our participants here, our 57 participants, thank you so much for joining the Science of International Migration webinar. We'd love to have your feedback, suggestions for future speakers, or questions you'd want to ask that we can send on to Mary. So to visit the IPL website to access the recording of this excellent talk. Thank you, and good afternoon or good morning or good evening for our Zurich folk,
Yeah.
and be well. Bye for now.
Thank you.